Well, unit dose and unit dosage form. When you're taking a medicine, any type of medicine that is in front of you, okay, if you don't need to do any kind of measurement, you just take it and administer it to the patient. This is called as unit dose dispensing. Means you're giving a drug that is already available in measured form. Means there is the strength available written over there that this is actually 20 mg tablet. The entire strip is in front of you, so you have the strip, you just take one dose and give it to the patient. So this is called unit dose. So whether it is a tablet, a capsule, or a transdermal patch, even already prepared pre-filled syringes, they are also placed in the category of unit dose. So these are all different dosage forms. So we will call this as unit dosage form, and a dose that you are giving at a time, at a single time, without any measurement. You just take the drug and give it to the patient. This is called unit dose. You are giving the unit dose, and when you are doing unit dose dispensing. Unit dose dispensing is giving the unit dose. What is unit dose? A dose that does not need measurement. Just take it and give it. Simple. We have already 50 mg, 20 mg, 30 mg, 60 mg tablets, strips. We just take one and we give it. So this action is called unit dose dispensing, and the one that you took is called a unit dose, and you did not do any kind of measurement. So this is called as unit dose. So unit dose means you don't need to do any kind of measurement. You just take it and administer it directly. That is simple. Well, the another one, the antonym of unit dose is actually the bulk dose. So the powders are actually placed in the bulk doses. So they are called as bulk doses. And this is the very difference between the unit dose and the bulk dose also. Okay. So I gave you two very important points: unit dose and bulk dose. Hope you got it. Thank you for watching.